Hello all, I am Dr. Neerja Singh. I am professor and head in Department of Pediatric Dentistry, and today I am going to discuss one very important aspect of pediatric dentistry, that is child abuse and dental neglect. What we should know under this topic is, first of all, what is child abuse, then clinical manifestations of child abuse. Afterwards, what is our role as a pediatric dentist or as a general dentist also? What are present day bylaws and what can we expect in our country today? Child abuse by definition is any recent act or failure to act on the part of a parent or caretaker which results in death, physical or emotional harm, sexual abuse or exploitation. Here it is very important to understand the term any recent act or failure to act. Means we are doing something with the child, we are acting something which we are not supposed to do, or failure to act means we are not doing something for the child which we should do for him or her. Alternative definition is an act or failure to act which presents an imminent risk of serious harm. Anything harmful which we are doing for the child or anything which we are not doing for the child and which can pose a serious harm. Child abuse is quite prevalent, and 37% of WHO member states they reported child sexual abuse, and 1 in 4 adults they confess that they were physically abused as children, while 12% of children were sexually abused in the last year only. So with these alarming data, we would like to know first what are the clinical manifestations of child abuse. An abused child can present with so many difficulties like physical injury and disability. This is very common. The child may be very stressful. There may be signs of impaired brain development, damaged nervous and immune systems. There may be delayed cognitive development. The school performance may be very poor and dropouts are very common. The child can reflect mental health problems. There may be a history of suicide attempts, and the child may indulge in increased health risk behaviors. There are various types of child abuse which are classified under physical abuse, sexual abuse, emotional abuse, medical child abuse, neglect, bullying, child trafficking, and dental neglect. Physical abuse is very commonly found in craniofacial, head, face, and neck regions. That's why we, the dental professionals, are at a very much chance of seeing and identifying such type of injuries. Oral injuries may be inflicted with the instruments such as eating utensils or bottles, like forceful eating can result in oral injury. This form of abuse may result in contusions, burns, or lacerations of oral soft tissues, fracture and displacement of teeth, facial bone, or jaw fracture. Some serious injuries of the oral cavity, including posterior pharyngeal injuries and retropharyngeal abscesses, may be inflicted by caregivers who fabricate illness in a child to simulate hemoptysis or other symptoms requiring medical care. Means few injuries are inflicted by the child's caregiver himself to gain attention because they want to create some symptoms on children and so that they can obtain some kind of help or medical care. Multiple injuries in different stages of healing or a discrete history should arouse suspicion for abuse. In fact, on the basis of injury, if we have to suspect whether it is because of abuse or it is because of some regular accidental happenings. So if there are multiple injuries which are in different stages of healing, like few are probably healed, few are partly healed, and few are quite recent or fresh wounds, then definitely this is not a common type of accidental injury. And a discrepant history means if the history and clinical presentation, the nature of injury and the history supporting that, it's not coinciding, then these things should be suspected. But for that, we have to know very clearly what are accidental injuries and what are non-accidental injuries. In case of accidental injuries, the parietal bone, occiput or forehead, nose, chin, palm of hand, elbows, knees, shins, these things are more prone for injuries. Accidental injuries typically involve bony prominences. They match with the history and they are in keeping with the development of the child. If the child is a toddler, child is not able to walk properly, in this case, there might be some kind of accidental injury which is coinciding with the development of the child. So the points to remember here is accidental injuries are such type of injuries which are typically involving bony prominences and they match with the history. While the non-accidental injuries are usually seen in those places which are not very prone for injuries, like ears, especially pinch marks. Pinch marks and then the triangle of safety. Triangle of safety is the area where ear, side of face and neck, top of shoulders, these portions, they make triangle of safety. Accidental injuries in this area are highly unusual. Then inner aspects of arms, back and side of trunk, except directly over the bony spine, black eyes, especially if bilateral, soft tissue of cheeks, intraoral injuries, forearms, genital injury, inner aspects of thighs, soles of feet. These are the areas usually for non-accidental injuries. So what are the points to remember here? That the concern should be raised by injuries to both sides of the body, injuries to soft tissue, injuries with particular patterns, any injury that doesn't fit the explanation, and delays in presentation, and untreated injuries. Frenum tear is in a very young non-ambulatory child, means if the child is less than 1 year and its frenum is torn. This should arise suspicion because in this group, such type of injuries are not very common. Forceful feeding of young infants usually caused by feeding utensils. Then bite marks. Bite marks should be suspected when ecchymosis, abrasions or lacerations are found in an elliptical, horseshoe shape or ovoid pattern. Bite marks are caused by two following phenomena. First is positive pressure from the closing of the teeth with disruption of small vessels. And the second is negative pressure caused by suction and tongue thrusting. In fact, to differentiate between animal bite and human bite, we should know a few things. Bites produced by dogs and other carnivorous animals tend to tear flesh, whereas human bites compress flesh and can cause abrasions, contusions, and lacerations, but rarely avulsion of tissue. Any intercanine distance measuring more than 3 centimeters is sufficient for an adult human bite. Here we can see the injury by an animal and the injury by a human. The difference. Then the next type of abuse is emotional abuse. Emotional abuse is any type of abuse that involves a continuous emotional mistrust between the caregiver and child. It is sometimes called psychological abuse also. Emotional abuse can involve deliberately trying to scare, humiliate, isolate, or ignore a child. It is very difficult to spot the signs for such injuries because there are no physical marks, so it's difficult to spot. Usually, this emotional abuse is found in association with some other type of abuse, but it can be seen independently also. Toddlers and babies, they are usually over-affectionate to strangers, but may be cruel to animals and other children. While in older children, there may be extreme outbursts. They can lack social skills, isolation from parents, and usually they can use language and mannerism that is not expected at their age. So all children, irrespective of their background, are at risk of such type of abuse. Sexual abuse. Any unexplained injury or fatigue of the palate, particularly at the junction of hard and soft palate. Visible oral injuries or infections are rare. Oral signs and symptoms of sexually transmitted diseases must be carefully looked. and report it. Then comes a term human trafficking. Human trafficking is a serious child health issue involving medical and dental ramification, but it is just beginning to be addressed seriously even in developed countries. It is defined as the recruitment, harboring, transportation, provision, or obtaining of a person for labor or services through the use of force, fraud, or coercion. Commercial sexual exploitation of children, child pornography, and survival sex. What is survival sex? It is defined as the exchange of sexual activity for basic necessities such as shelter, food, or money are considered as sex trafficking. It is very difficult to know the precise number of children experiencing sex trafficking, but there is substantial number of children are being trafficked even in developed countries. The average age of children who are exploited for sex is 12 years old, and children as young as 6 years old are also targeted. Child trafficking victims have twice the risk for dental problems because they often suffer from inadequate nutrition, leading to retarded growth and poorly formed teeth, as well as dental caries, infections, and tooth loss. Then comes bullying, which is very common in schools also. 30% of children in 6th to 10th grade, they have reported being either being bullied by others or they themselves have bullied other children. Children with orofacial or dental abnormalities are frequently subjected to bullying. Sometimes other children bully them on the basis of their appearance or their irregular teeth. This may have serious psychological consequences, including depression and suicidal ideation and poor oral health. Then there is a term medical child abuse. Medical child abuse was earlier known as Munchausen syndrome by proxy. It is defined as the maltreatment of child by a caregiver who falsifies or creates child's illness, leading to unnecessary and potentially harmful medical investigation and or treatment. In medical child abuse, it is common for caregivers to engage the social media community in discussing the medical condition of the victim as a form of attention seeking. Abusive caregivers frequently have professional training in the medical field, so they are very well aware that which type of signs or symptoms they should create. They show a lot of attention and affection on with children, with the child when others are present, but essentially ignore them when they are in private. MCA or medical child abuse can be confirmed by means of so-called separation test, in which the child remains under close medical surveillance without any contact with the caregiver. So if in the absence of caregiver, the child is improving, the condition is improving, it means it is a case of medical child abuse. Then comes dental neglect. Neglect is something which we can define as a willful failure of parent or guardian. Means parents, it's not that they cannot give the, attention, but they are willfully failing to give attention to their child's oral health problems despite adequate access to care. They don't seek treatment necessary to ensure a level of oral health essential for adequate function. Dental caries, periodontal diseases, and other oral conditions can lead to pain, infection, loss of function, and worse if left untreated. So the undesirable outcomes can affect the child's, self-conscious learning, communication, nutrition, and other issues. So now, what is our role as a periodontist or as a general dentist for for an abused child? So how can we report child abuse? What are the documentation required to report child abuse? Where can we report child abuse? And are we lawfully entitled to report it? What are our responsibilities? All members of medical fraternity are expected to follow the 4 R's. That is, recognize, record, report, and refer. So we have to first recognize the signs of child abuse. Then we have to record it. We have to make a proper data. Then we have to report it to the concerned authorities, and then finally we have to refer it to some other specialist for further treatment if required. So what are the steps to report a child abuse? The prevention and diagnosis of child abuse is usually undertaken by a pediatrician or a periodontist. Dental professionals have an important role to play, as 50 to 75% cases of physical indicators are present in the head and neck area itself, which happens to be the most easily targeted and observable. During documentation, we have to take a very thorough, proper history, then physical examination, photographs, radiographs, and laboratory analysis. Under history taking, once we recognize that something is not right, the child must be questioned separately. The child should be separated from parents or caregivers, and this version should be recorded. Any discrepancy between the statement of the child and parent should be documented. While documenting child's medical history, a specific note of medical conditions or manifestation depicting child abuse should be noted. Parents and caregivers should be questioned about nature of past injuries and hospitalization, if any. Under physical examination, right from the child walks into the dental office or medical office, it is the duty of paradental or paramedical staff to observe the state of the child in terms of hygiene, emotional status, and overall physical well-being. Any discrepancy observed should be reported immediately to the doctor. The doctor must perform a comprehensive physical examination, starting from weight, height correlation to examination of extremities, skin, scalp, thorax, abdomen, back, oral cavity, and documenting any suspicious looking marks or lesions. Then we should take very good quality photographs. There are both general and specific criteria for photographing, and general measures should include a tag with date and reference number alongside the area being photographed. And a millimeter reference scale should always be placed next to the photographic site. These things are very important because these things might form a very important evidence in future in any court trial. Then under lab investigation, surface smear layer analysis for detection of saliva or other body fluids for DNA analysis can be taken. Replica of lip prints or bite marks for evidence maintenance. Ophthalmologic examination in child under 3 years of age is also recommended, and skeletal survey in child under 2 years is recommended. Once we establish or we recognize that there's some kind of abuse or neglect, the same should be conveyed to parents if appropriate. And the lawful requisite for reporting such injuries to the law governing bodies must be highlighted. In our country, there are online systems for children to report sexual abuse. The Ministry of Women and Child Development has made one e-box. This is online reporting system, which is received by National Commission for Protection of Child Rights. Then we can report it to police. Police officers are legally bound to address child abuse complaint. Then there are certain non-governmental organizations where we can find our nearest link, our nearest locality on this particular link. Then the question comes, are we legally bound to report? So the answer is yes. As aware citizens, as aware people, they are legally bound. In fact, there have been cases abroad where one pediatrician and his staff failed to report the suspected pregnancy of 11-year-old girl, and they faced action. While in another case, a pediatrician suspected teen pregnancy and referred the girl to gynecologist for confirmation. In this case, this pediatrician also faced action. Why? Because as we discussed in 4 hours, before referring the child to some other consultant, we have to report it to the concerned authority if the suspicion arises. Because other consultant or specialist may not report it. So before referring, always report it and then refer for further investigations or further opinions. PANDA is an American initiative to address child abuse. And what are the conditions in our country? How many of us have ever reported? How many of us have ever tried to check? And how many of us really know how to report? The answer may not be very encouraging. In our country, we have the largest number of children in the world, which is around 40% of our population. 69% of Indian children are victims of physical, emotional, or sexual abuse. New Delhi has an over 83% abuse rate. 89% of the crimes are committed by family members. Boys face more abuse than girls, and more than 70% of cases go unreported or unshared, even with parents or family. Apart from child abuse, there is also one more problem in our country, that is gender inequality between a male and female child. Sometimes female children are more prone for abuse. The gravity of situation appeals the issue of child abuse be placed on the national agenda. In India, unfortunately, the crisis of child abuse has not received enough attention. The Juvenile Justice Act 1986 defines child sexual abuse as interaction between a child and an adult in which the child is being used for the sexual stimulation of the perpetrator or another person. There is a need to develop standard protocols on child protection mechanisms. The scheme should strengthen support services provided under the Juvenile Justice Act 2000 for children in need of care and protection and children in conflict with the law. The POCSO Act was introduced, which the full form is the Protection of Children from Sexual Offences Act. These legislations make it mandatory for healthcare professionals to report cases of abuse to police or child line services. Failure to do so shall invoke punishment with fine or imprisonment up to 6 months or both. Any false reporting solely for the purpose of humiliating other party, extortion or defamation also invokes the same punishment. So the worst thing, even after this, the worst thing that can be done for an abused child is nothing. It means if we are suspecting some kind of abuse and we are not doing anything, this is the worst thing that can be done for an abused child. In our country, Ministry of Women and Child Development have taken initiatives. There is Child Line Service 1098, which we can call for help, and they have various functions. They are responsible for such kind of children. Then finally, how can we prevent? Because prevention is always better than cure. So how can we prevent such kind of abuse? Intervention that support parents and caregivers, because sometimes the parents and caregivers are not in a solid mental status, or sometimes they have some kind of problem, financial, some other psychological problem, their marital problem. So some intervention should be given for such kind of parents and caregivers. Promote non-violent norms and values in society. Provide education and life skills training. Strengthen families' income and economic security. Offer high-quality response and support services. Create and sustain safe environment for children. Implement and enforce law against child maltreatment. So with this, I'm finishing this important topic. Thank you. Thanks all.